All right, good afternoon, everyone. I hope everyone's enjoying their lunch. Thank you for joining us. We're gonna get started. So happy Lupus Awareness Month. Give a round of applause, it's Lupus Awareness Month. My name is Priscilla Calvache. I'm the Assistant Director for Lupus Programs and Community Engagement here at Hospital for Special Surgery. It's really a pleasure to welcome you all back on site at Hospital for Special Surgery for our Living Healthy with Lupus program. This program has been sponsored by the Department of Social Work Programs for the past 17 years. So let's give it up for all of you today. This is our first program back post-COVID, so we're so excited that you're all here with us today. Just some information about the Department of Social Work Programs here at HSS. We offer the most lupus support and education programs in the country. All of our programs are free. They're available in both English, Spanish, and Chinese, and we really invite you to learn more about our programs today and our Lupus and APS Center of Excellence by visiting our resource table or coming to talk to any one of our staff members today. So today we're excited to be joined by Dr. Lisa Sammaritano, who's going to be leading an interactive discussion on alternative treatments in lupus. And before I get started, just some brief housekeeping rules. Restrooms are located right outside the conference rooms down the hall. We ask you to please place your cellular devices on silent or vibrate just to minimize any noises during the presentation. And as everybody is aware that today's presentation will be recorded and the recording will be made available to all participants via email. So lastly, I would like to introduce our program evaluation. Everyone should have an evaluation attached to their PowerPoint today. This is extremely important because this feedback helps us to inform future programs. So we ask that you please not leave us today without completing that on your way out. So without further hesitation, it's my pleasure to introduce our speaker this afternoon, Dr. Lisa Sammaritano, who completed medical school at Weill Cornell Medicine residency at New York Presbyterian Hospital and rheumatology fellowship at Hospital for Special Surgery. Her research and clinical practice focus on systemic lupus erythematosus, antiphospholipid syndrome, and reproductive issues in rheumatic disease patients. She is the lead author for the recent American College of Rheumatology guideline for the management of reproductive health in rheumatic and musculoskeletal diseases. Dr. Sammaritano also serves as director of the Rheumatology Reproductive Health Program at HSS and is a member of the Barbara Volker Center for Women and Rheumatic Diseases. Today, we have the pleasure of having Dr. Sammaritano present on alternative treatments and lupus. Let's give Dr. Sammaritano a warm welcome.
Well, thank you so much. I will tell you, I'm not talking about reproductive health today, even though that is a focus of my research. One of my colleagues, Dr. Siegel, is going to be speaking about that later this month, so you need to wait a couple of weeks. But what I am talking about is living healthy with lupus. And I want to thank the lupus social workers for inviting me to speak to you about this. And I have to say, this was a topic that they suggested to me. So it did prompt some questions in my mind. How does one live life healthy with lupus? Well, first, can you hear me okay? Yeah. What is living healthy? And I think for most of us, living healthy is sort of what we will do or try to do to get to that state of wellness, which is something that may be hard to define, but I think is a goal for many people. And if you look on the internet, as I did, to find images to show you the components of wellness, you will find many of them. Some have 5 components, some have 8 components. I just chose this one because I like the colors, but it is just a way of making the point that wellness or living healthy is about more than just physical health at any one moment in time. It is also about mental and emotional health, social health, and all of the other components that we think are important. So living healthy with lupus, well, how do we define lupus? And I think how we think about lupus depends to some extent on whether we are a rheumatologist or a patient. So I show you here on the left, this is something that was published in 2019, and these are the most up-to-date SLE classification criteria. What that means is that this is the list of symptoms and lab findings that are most specific for lupus. And when a rheumatologist is thinking about enrolling a patient, for example, in a clinical trial, say to see if a new medicine is effective, the patient will have to have the requisite number of points on this that, shows us that, yes, she definitely has lupus. But it doesn't capture all of the lupus patients. And on the other side of the slide, I have something from a recent publication looking at heterogeneity in lupus. And that just means the variability that I think we all appreciate that occurs from patient to patient in systemic lupus. Many patients find that they have symptoms that are different than their neighbor or friend who also has lupus. And these authors tried to make the point that the patients are quite variable, sometimes one to the next. They also show that the immunologic changes that are identified in lupus are also variable from patient to patient, involving all different parts of the immune system, not just one type of immune cell or another type of immune cell, but really almost every part of the immune system, including cytokines and interferon, which are sort of chemical messengers for inflammation. And all of this together leads to what they call clinical heterogeneity, meaning variation in terms of symptoms that affect different individuals. And you can see that, while some of these things do appear on the ACR classification criteria, for example, kidney disease or neuropsychiatric or brain disease, some do not, and yet are also important symptoms that patients with lupus may notice. Fatigue, for example. So I think that there is a little bit of a difference depending on your perspective in terms of what we consider lupus to be. And then finally, our question, well, so what is wellness for a patient with lupus? How do we define it? How do we measure it? And who decides what wellness is for someone with lupus? On the left, this is a data form that is called a SLEDAI. This is a form that has been used by doctors in studies to come up with a number to represent how active one's lupus is. 0 is not active at all, remission. 4 is a little bit active, low lupus disease activity. 15 is, wow, this is very active lupus, we need to treat this now. So that's one way of looking at someone's health in terms of their lupus. The other way is shown on the right. And these are forms, again, I don't want you to try and read them, I just wanted to show them to you, that are patient-reported outcome measures or PROMs. So there are things that patients can tell us about how they feel with lupus that is not picked up on this SLEDAI, which is much more clinically focused. So on these patient-reported outcome measures will be questions about what you can or cannot do in the course of your day. Can you go for a walk comfortably? Do you have the energy to make your own dinner? Things like that. What is your mood like? How does lupus affect you both physically, but also mentally, socially, emotionally? So I wanted to sort of put that out there. And throughout the rest of the talk, I will try and focus on treatments or therapies suggested for both of these kinds of lupus-related symptoms. And sometimes the therapies are different. So we'll start with standard therapy, and I am sure that most of you are familiar with most, if not all, of these names of medications. So corticosteroids, patients love them and hate them. And I think, and rheumatologists feel the same way. You know, I can tell you when my daughter was young and she would hear me talking to patients sometimes on the phone or talking to colleagues, she would say she didn't understand why we started everybody on steroids and then our biggest goal was to get them off steroids. And it's really true. But we use them when we need them, and we try and use them in as low a dose or for as short a period of time as we can get away with. But as I'm sure many of you know, most of our other medicines take longer to kick in, and so sometimes we don't have a choice. Hydroxychloroquine is a very important medication for patients with lupus. It stabilizes things within the immune system. Many studies from many different centers show that taking hydroxychloroquine as sort of a baseline medication reduces risk of flare, and it also improves all kinds of outcomes in terms of, reducing chance of kidney disease, reducing chance of other kinds of lupus-related damage. And so we recommend it for all of our patients who are able to take it, who can tolerate it and don't have side effects. And then there are what we call the steroid-sparing medications. These are the immunosuppressives that are sort of our classic immunosuppressives, mycophenolate, azathioprine, and cyclophosphamide. We don't use cyclophosphamide quite as often as we used to, thankfully. That is the IV medication that is probably our most powerful one. We save it for patients with very serious lupus inflammation like kidney disease or brain or central nervous system disease. We tend to use mycophenolate mostly now because it is quite effective and it tends to have less, for most people, in the way of side effects compared to, say, azathioprine. But there are other medicines we use too, methotrexate, tacrolimus, even thalidomide is used for some patients with lupus who have certain kinds of rashes. And then finally, IVIG or intravenous immunoglobulin, also used sometimes for specific lupus manifestations. So when I was talking to you about the American College of Rheumatology, the ACR, that works hard to try and put together information and recommendations that are helpful for rheumatologists in caring for patients with lupus and other autoimmune diseases, there is a European equivalent, and that is called EULAR. They recently published a couple of guidelines. This one was on lupus excluding kidney disease, because kidney disease gets its own guideline. The ACR is actually in the midst of putting together our own recommendations, but it is not near being done yet. I'm showing you this because I thought it was just a good way of sort of representing what your doctor is thinking about when they make specific medication recommendations. So you can see that we think of lupus activity, not the specific organ system involved necessarily, but the activity as a whole as being mild or moderate or severe. And what medicines we use depends on where on that spectrum, or suggest anyway, depends on where on that spectrum one fits. So this is, a rough guideline, but it has to be individualized for the patient because every patient is different. Somebody might have side effects with the first 3 medicines you suggest. So it's a starting point. This is a list of the more recent therapies. So please don't be put off by this picture. I just put it there because I just wanted to give you a sense of the fact that with lupus, years ago we used to think, it's just about one kind of cell, the B cell, that's making the DNA antibodies. But we know now that virtually every part of the immune system is involved in the development of lupus and the manifestation of lupus activity. And that's what this picture is designed to show you. The details are not important. But I did circle the medications that I've listed to the left. So you can see that these medicines have been tried and studied in lupus because someone in a lab somewhere figured out that this medicine might block this particular pathway that seems to be very important in pushing on lupus inflammation. So rituximab is, I have to say, not FDA approved for lupus, but we use it frequently. It's supported in a number of studies, but the big trials that were done to gain FDA approval did not show enough benefit. The other medicines are FDA approved, and these three are the first three FDA approved since Plaquenil many, many years ago, or hydroxychloroquine. So one is belimumab, and that initially was approved to treat any kind of lupus symptom except brain or kidney lupus. In the past couple of years, it's been approved for kidney lupus as an add-on medicine. Voclosporin is an oral medicine that was approved as an add-on medicine, usually to mycophenolate for kidney lupus. And then finally, the last one, anifrolumab, is a novel kind of medicine. It targets interferon, which is felt to be a really important messenger and marker for active lupus, and that is especially good for rash. So what I'm showing you here is the kind of therapy that is focused on the SLEDAI, right? The form I showed you that your doctor is checking things off on to see how active your disease is. This I put in because even though it is certainly not ready for prime time, I've had a lot of patients ask me about CAR T cells for lupus. And so you may have, it was in the news this past year quite a bit because it really is a novel potential therapy and very exciting, but still, you know, a ways down the line. So CAR T cell therapy is really, has been an incredibly effective therapy for patients with certain kinds of cancer. And some rheumatologists in Germany used this for 5 patients with lupus, modified it to work for lupus. And so I took this slide from Twitter, believe it or not, because I thought it was just a really nice graphic representation of what they do. So you don't have to read any of this. I just put it in case you want to come back to it later. But what they do is they take people's blood. They take out the T cells. They isolate the T cells, which is one type of immune cell that, you know, we have. They then, they inject like an inactivated virus with a gene that makes the T cell into a cell that will destroy B cells that are felt to be bad in lupus. That is B cells that are expressing this CD19. So they manipulate your own T cells, they grow them in the lab, they get them ready to give back to you, but before they give them back to you, they treat you with very aggressive chemotherapy to wipe out your immune system. So it's similar to what they do for bone marrow transplants, right? They have to get rid of the old cells and then let them come back. But as they come back, these T cells that are then given keep the B cell population low so that they can't be causing more active lupus. Anyway, it was only 5 patients. They were all young, mean age 22 years. And, you know, they had very active disease that had not responded to any other therapy. But they found that they had a drug-free remission over their mean follow-up of 8 months. And so they thought it was very intriguing and potentially maybe a useful therapy in the future when larger studies can be done. Okay, so to come to some of the other therapies, what I'm calling here non-pharmacologic, you might call them complementary or alternative. These therapies mostly, but not always, are focused on the kinds of things that we ask our patients to report on these patient-reported outcome measures, the PROMs. So lupus patients as a whole report high levels of things that are not on that SLEDAI form: cognitive difficulties, depression, pain, fatigue. Fatigue, in fact, is one of the most common symptoms, often disabling. 80% of lupus patients in one study complained of fatigue, and 50% of them thought it was their most disabling symptom. So, you know, And I can add from personal experience, I do think it is one of the hardest lupus symptoms to treat. And depression and anxiety, highly prevalent for obvious reasons, and all of these things together really impact quality of life. So non-pharmacologic therapies may be important adjunct therapies to the standard therapies I showed you that might have potential benefits. We would love for them to reduce disease activity. I can tell you now, before we even continue, most of them do not. But many of them reduce some of the patient-reported symptoms that are impacting their quality of life, such as fatigue, depression, or cognitive complaints. So I've put them into 3 categories for you. One is lifestyle, one is diet, one is supplements. Before I get to lifestyle, I just wanted to show you this figure from a paper that was entirely focused on fatigue in lupus. And it was really a great paper because it made some points that I feel like I have been dealing with and trying to discuss with my patients for some time now. And the first important point is that fatigue in lupus is multifactorial. So it isn't just because the disease itself, as we recognize disease activity with that SLEDAI form, yes, it is part of that. Fatigue comes when disease is active, but there are all of these other important factors, right? You can't move because you're in pain. Well, so reduced physical activity contributes to fatigue. Having had organ damage in the past contributes to fatigue. Mood changes contribute to fatigue. Sleep quality contribute to fatigue. And in this paper, they put together sort of suggestions for how to best treat fatigue in lupus. And the bottom line is that you need to try to identify the factors as best you can. Then you target each of those factors. So if disease activity is high, you give an immunosuppressive agent. But if other things are important, physical activity is lacking, maybe we recommend physical therapy or exercise, other lifestyle changes, psychological factors, maybe we recommend focusing on those as an adjunct to help people to have less fatigue and a better quality of life. So this is the next couple of slides, just show you some information on exercise and psychological and behavioral approaches. I put the references there and I've described the studies to some extent for you. Again, not because I expect you to go look them up, although you are welcome to do that. But to me, it validates the importance of this area in the medical literature, and it validates the fact that there are a lot of physicians, other scientists working hard to better understand this area and what might be helpful. So there are a lot of benefits with exercise and with some of the psychological or behavioral approaches. I'm not going to go into such great detail, but if you look at some of the reviews that have looked throughout the literature and tried to put all of the information together, if you look at these 5 outcomes, fatigue, depression, pain, quality of life, and disease activity, in 15 studies, over 800 participants, and the authors of this study put all of the data together, came up with support for aerobic exercise and psychological or behavioral interventions, including counseling, education, cognitive behavioral therapy, mindfulness-based cognitive therapy. I mean, they didn't split them up because there were just too many variables. They grouped them together. But they found that both of these types of interventions gave an improvement in quality of life for patients with lupus in terms of fatigue, depression, and pain. They did not affect the level of disease activity as measured by our standard measures. However, another study looked to see if there were other benefits to exercise in lupus, and they did find that for women with lupus who have, like a low level of disease activity, that exercise training can actually give them additional benefits in terms of cardiac health, respiratory health, and also benefit fatigue and depressive symptoms. And they classified that as moderate to strong exercise, 30 to 70 minutes, 2 to 3 times a week. They were careful to say there are no studies in patients who have active lupus. We don't want a patient with active lupus trying to go run, a half marathon, obviously, or even around the block if you are in pain and have active disease. These were patients who had mild inactive disease. But for those patients, it did make a difference in some physical manifestations of aerobic capacity. And of course, we know that this kind of exercise can improve one's bone density, which is such an issue for lupus patients who are on steroids for so much of the time. Muscle weakness can be caused by steroids, and so exercise can help with that. Finally, it may help reduce risk of diabetes or metabolic syndrome, all of these things that to a large extent are related to steroids, but are things that our patients with lupus have to deal with. So, the take-home point, I think, is that aerobic exercise and psychological or behavioral therapies can really help in a quantifiable way, as seen in these studies. What about diet? I cannot even estimate how many times my patients ask me, is there a specific diet that I should be following? I think it's a natural human impulse, right, to try and change whatever you can in your immediate environment to make yourself better. We don't have as much information as we'd like to have about diet, but there are a few studies. One was this, published actually over 10 years ago, where they compared a low-carb diet versus a diet that was just restricted on the basis of calories. They found that both resulted in weight loss for patients, and that both of them helped in terms of fatigue. But it was a very small number of patients, and again, it was a limited study, but suggestive and I think promising. And then this study, published a couple of years ago, looked at the Mediterranean diet, which is, suggested as being a generally incredibly healthful diet, especially for cardiac disease. But it looks as though, based on this study, that the Mediterranean diet may help lower disease severity and cardiovascular risk in lupus patients. They studied patients specifically who were on steroids at that time. And so this is the Mediterranean diet, if you're not familiar with it. That's about as much as we know. So I do think that considering a Mediterranean diet is probably a good thing for all of us. I am not good enough about trying to follow that. I wish I were better and will try to be. But it's a very healthy diet, and it may make real changes in terms of lupus. I mentioned the gut microbiome because, like the CAR T cell study that I mentioned to you early, it's something that makes its way into the news. So I'm sure all of you have seen, stories or whatever about the gut microbiome. All that means is it's a way of describing what microorganisms live in our intestines. And there are thousands and thousands, if not millions, that do. And the hypothesis is that an imbalance in the ratios of different microorganisms may make a difference in our overall health. And that has been looked at for cardiovascular disease, for lots of things, including lupus. And so one study did show there was a change in the ratio of certain organisms in lupus patients versus those who did not have lupus. There was a mouse study that suggested in a mouse model of lupus that giving an antibiotic therapy that changed the balance of these organisms led to less autoimmunity. But there's not enough information yet for us to suggest specific interventions, certainly not antibiotics or a specific gut microbiome diet or probiotic. But I do think it's a very intriguing area of research, and there's really a lot going on right now. So, maybe in a couple years, if I give this talk again, I can update you and we'll have more to say. What about supplements? Obviously, these are dietary as well, but I thought I would just focus on a few supplements that are commonly proposed to be helpful for patients with lupus. So the first one I wanted to talk about are the omega-3 fatty acids, or really polyunsaturated fatty acids. And again, these fatty acids have long been recognized as having the ability to reduce inflammation of almost any kind, as well as disease activity in some autoimmune disorders, and they limit oxidative stress, another thing that leads to inflammation. The most biologically active ones are EPA and DHEA, and the main sources are these kinds of oils: krill oil, fish oil, olive oil, canola oil, flaxseed oil, and fish, salmon, tuna, sardine, or herring, if you like those. But so these really, I think, more than any other individual supplement, have good studies to support their use. So first, this is, again, not to give you the details, to show you the big picture. This is from an article that was looking at various life factors that affect systemic lupus, published last year. So all of this stuff in the sort of pink or peach is just stuff from basic science experiments that have shown that these fatty acids, calorie restriction, and vitamin D all have an impact on some aspect of the immune system. And so the authors put together this to show possible interactions. This paper came out, I think, last year, and was what we call a meta-analysis. So I alluded to this before, but I'll just repeat it. The meta-analysis is when there's some interesting studies that have been done looking at a certain treatment or supplement, but they're all sort of small, and it's really hard to know for sure that there is a benefit. So what these specialists do is take all of the information and they put it all together and they reanalyze it. Obviously, the studies have to be similar enough so that the supplement is the same and they're looking at the same outcomes. So that is what this group did. They took 5 controlled studies, 136 participants in the comparison groups, 138 in the treatment groups. All of them had lupus. So half got these fatty acids, omega-3 fatty acids, half did not, on average. And they noticed that the omega-3 fatty acid group had a significant decrease in their lupus disease activity on that SLEDAI scale that I have shown you each time, the one the doctor's checking off things on and ending up with a number. So the average decrease was 0.9. Nothing else changed, just they started taking omega-3 fatty acids. They noticed the effect was even greater in patients who had a higher number on the SLEDAI scale. So if disease is more active, there was more benefit. And the other thing they noticed, which I think is so interesting, and of course you would predict it, is that the people who benefited the most were those who never ate fish. So there are people who are eating fish, right, all the time. Taking extra, omega-3 fatty acids is not, it's not going to help. But if you don't like fish or if you don't eat it often, this might be a good supplement to consider. And there are mouse studies that have seen decreases in levels of autoantibodies and other inflammatory markers. And this study is done in patients with rheumatoid arthritis. But just to go back to the fish eating, these investigators found that patients with rheumatoid arthritis who ate 2 or more fish meals per week had lower disease activity. So, you can translate it to a diet change if you don't want to take the supplement. And there is an ongoing trial using krill oil in patients with lupus. Some of you may be familiar with it. That is, I think, in progress now. Krill oil is apparently like a super duper form of omega-3 fatty acids because it has the best ones in there. Krill, I put this really more for myself than you, I did not know, but they are small shrimp-like crustaceans and they're very rich in the EPA and DHA. And this is what they look like. I was curious. So, eating more fish, specifically salmon or tuna, because not all fish are the same, or maybe these supplements really might make a difference. What about vitamin D? Another common question, and we check levels for this frequently in our patients. So why are we so concerned as rheumatologists with levels of vitamin D? Well, the most pressing reason is that vitamin D is really important for bone health and calcium absorption. So if patients with lupus who are on corticosteroids that can thin your bones and who are told, please don't ever go out in the sun so you don't have a flare, well, vitamin D is the main source of it is our skin, from sunlight hitting our skin. So most patients with lupus, if they're not taking a supplement separately for vitamin D, many people are deficient or have a lower than optimal level. So this deficiency is common in lupus. Vitamin D, salmon and tuna, I'm telling you, this should be your new diet because it's present in salmon and tuna, but most of the time we get it through the skin with sun exposure. A number of studies have correlated higher levels of lupus disease activity and fatigue with lower levels of vitamin D. So immune cells are known to have receptors for vitamin D, like all of the important immune cells. And we do think that vitamin D may be important in modulating the immune system. The recommended target value is 40. So usually we say that people have a low level below 30, but really it's better to aim for 40. And again, another review of the literature as a whole showed there was, in these 6 different trials, pooling together the information, there was a decrease in the SLEDAI number. The rest was inconclusive as to whether it affected fatigue, whether it affected some of the more specific measures we use, like the DNA antibody or complements. So I think that it is a good thing to pay attention to. It's good for bone health, and it may help disease activity. Well, another popular supplement in recent years has been curcumin, which is the active ingredient in the spice turmeric. So it is also suggested to have anti-inflammatory properties. And again, another sort of broad-based review of studies that have been done. And you'll see in this review, there's only 3 studies. There hasn't been as much research in this area yet. One study suggested maybe a decrease in protein in the urine in patients who had kidney disease, but didn't find measurable other changes. The other thing is that even with just those 3 studies, there was a big difference in the doses that were given. And, you know, it's hard to come up with a definitive recommendation or conclusion. We know it's anti-inflammatory, but you do need to use caution because we don't really know yet the safe dose range for supplementation, and there are no real guidelines for that as of yet. It can impact the benefits of vitamin D because it interferes with their receptors, and absorption may be unpredictable. There have also been suggestions that they can interact with medicines for various other medical issues. So I think this is an area where we need more research. Hard to recommend it as of yet. And then this is, I think, my last supplement. I'm almost done. And this is DHEA, which is dehydroepiandrosterone. It is a very mild male hormone that is present in all of our bodies, and men and women. So it's an adrenal steroid hormone. It also has been reported to be lower in patients with lupus than in the general population. But the studies on whether giving it back to patients as a supplement is beneficial have been very mixed. So there have been a few controlled trials, you know, where the patient doesn't know if they're getting DHEA or a placebo. There was, and in one of them, there was a lower number of flares, but no overall change in disease activity. Another study found, though, that it enabled more patients to taper their prednisone to a dose of less than 7.5 milligrams with the dosage that was used in the study, 200 milligrams. And in another study, there was a trend towards a lower number of patients with active disease, but a third of the patients stopped the medication over the course of the study because of side effects. The most common one was acne. Another common one was lowering of the voice in women. So, and that was at this dose of 200 milligrams. A study looking at benefits for fatigue did not find any benefit. It has been shown to maybe be protective for bone density, but we have lots of things that are protective for bone density. So I do think that the high rate of side effects and the minimal benefit at the studied dose doesn't make me want to recommend this for my patients. Other alternative and complementary medicine, I couldn't go over everything, obviously, but there are many other things that patients may seek out to see if it gives some benefit or some relief. Acupuncture is one of them. Believe it or not, there's really just been this one study specifically looking at acupuncture in lupus, and the results suggest that patients who got the acupuncture and patients who got what they call sham needling, which is putting acupuncture needles in non-acupuncture spots as a control, they actually both those groups improved more than patients who had no needles. So it's hard to know whether the needling did make a difference or not. And then, of course, things like yoga and Tai Chi, lots of studies looking at benefits in terms of quality of life and fatigue, musculoskeletal pain. And the studies, though, have been more in osteoarthritis, some in rheumatoid arthritis, really no great studies published to date for patients with lupus. But I think they are incredibly beneficial and fun. And I think we have a Tai Chi class, right, as part of our Lupus Awareness Month. Yeah, it's the 18th. This is my last slide, and it is just sort of a reminder to not forget about lifestyle things that we should avoid, right? So we talked about lifestyle things to do, exercise, maybe take omega-3, alter your diet, eat that Mediterranean diet. But there are things that have a negative effect on lupus, not just on one's health in general. And that includes cigarette smoking and, of course, excessive, UV radiation. I'm not so sure about caffeine-rich beverages and alcohol, but the authors of this paper apparently thought that that was a possibility. I'm not familiar with that. But I put it up there again to remind you that there is more to living healthy with lupus than standard therapy or an alternative therapy like a supplement. In that original schematic I showed you from EULAR on how to treat lupus with all of our medicines, this was on the left side, and it was again a reminder: sun protection. Of course, get vaccinations that will protect you from infections that you may be more vulnerable to because of immunosuppressive therapy. Exercise, don't smoke, try and control body weight, blood pressure, lipids, glucose. For patients who have antiphospholipid antibody, obviously anticoagulation if indicated. And then my last point, so, take, of course, the medicines you and your rheumatologist agree are the right ones for you. Bring up some of these alternative things if you are interested. Focus on other lifestyle things that will be beneficial. And don't forget about, the other health issues, and that includes high blood pressure, high cholesterol. So many of these are related to our therapies for lupus, but they really can cause lots of issues over the years. So it's really good to be aware of them and working on them from an early age. So I think that is my last slide. Yes. So I'm happy to take questions if you have any.